All right. So, good morning. Thanks again for having me, and Dr. Lewis, thanks for the nice intro. It's really nice to be here. My goals, I guess, in the next 25 minutes or so is to hopefully get you guys a bit excited about global health, and also tell you a little bit about the program that we have within the Faculty of Medicine, and some opportunities for you guys in the coming years. So as Dr. Lewis has mentioned, I split my time working in the global health field and working in the pediatric emergency at the Stollery, and had done my residency here in pediatrics. So I'm a U of A grad. And just a quick question. So Marge, will you be going through the slides, I guess?
Michelle is operating the slides, and
Michelle's operating the slides.
We can both see and hear you, so you just need to say when you want the slide advanced.
All right, so we'll move on to the next one. So I thought I'd start with just a bit of a definition. There's many different ways to define global health. One important concept is the fact that it's more than just international health. Some define it as an area of study, research, and practice, places priority in improving health and achieving equity in health for people worldwide. So, a little bit of a lot of things there. And when we say practice, of course, we mean, clinical practice, seeing patients, treating illnesses and so on, but it's also education, and it's also research. And very importantly, it's a concept that focus a lot of attention on inequalities, as we saw in the definition there, looking at equity, and also disparities in health. And that's one of the elements that really makes it a very broad theme and applicable to many different settings in the world. And finally, it's very important to realize that it really emphasizes a multidisciplinary approach. And for many of the projects that I've been involved with, it is always multidisciplinary. It's not, it's not just one specialty, even if you're going with a very specific focus. There are many people involved, both local expertise, along with sometimes people coming from other settings or other countries to bring a little bit of their knowledge and experience as well. And reason why with you guys coming from 5 different programs, I understand this morning a good example of the multidisciplinary component of it. So we'll go on to the next slide. So importantly, why get involved early? You guys are all starting, and why is important to find a little bit about now. Some of you may have some background already in global health, or have done some projects and so on. I think people are coming from all sorts of different backgrounds, but I thought I'd give you a little bit of my perspective, a little bit of my experience, and what are potential benefits of starting this early, in the next couple of years in your training. The next slide. So many benefits. I've listed just some that I thought were important. So, of course, experiencing different health systems. One thing you realize as well, there's a little bit of rumbling in Alberta about some private clinics and so on. But, of course, for the most part, the Canadian system is public and so on. But when you go to other settings, and certainly within developing countries, there's almost always a private versus public interface. And you really realize the vast majority of patients, the patients you're seeing in the villages and so on, for sure, for them, there is really only the public or the government-run hospital and so on. There is really no choice at all, but people with a bit more money and funds and so on, for all of their care, some private clinics and private healthcare, and having to pay, large amounts. So that, I remember as a sort of a junior med student, was a real eye-opener for me to see that. Being exposed to, health inequalities and poverty, like the amount of poverty you can see in some settings. And of course, even within Canada, right, there's some communities really challenged with in terms of socioeconomic and so on. So to be exposed to that, fairly early, I think is important. And the challenges that both the patients and the healthcare providers go through, and how they go around those challenges, whether it's logistics, medical equipment, and so on, finding ways, I think, is really useful to be exposed to that. And of course, it's not just about the medical aspect and the healthcare, but if you are in a different setting, you're also experiencing different cultures, different beliefs, whether it's traditional medicine, herbal medicine, and so on, depending on where you are. Lots to learn, and then languages as well, and sort of becoming a better healthcare provider as someone practicing in Canada in the future, and so on. Someone who's more culturally aware. You can potentially become a better advocate for communities within Canada, whether or not you continue doing, some international projects after, but just being more aware within your own patients, within the people you're seeing and through your practice and so on, and a more flexible approach in your care, whether it's, expectations or what is available for the patient and so on. You've seen people in small communities deal with the logistical challenges of, trying to get blood work on someone and send it off, or trying to coordinate just a simple chest x-ray. And so, having that flexibility, having learned from what you've seen and bringing that back to Canada, I think has a lot of really important potential. And finally, in terms of your own future, so for me, having done some early electives, for example, and being involved early, did help shape my career. Like Dr. Lewis mentioned, in pediatrics, I knew with my interest in international health, there would be lots of potential within pediatrics and so on around the world. And then finally in emergency medicine. And some of you may find that some early experiences or at some point in your training may affect your career choice and even your training choice in terms of going further and so on. Next slide. So all of that said, of course, early experiences are good in my mind. However, it's really important to have a good structure, have good supervision, and that there are safety measures in place that if you're planning, now I'm speaking, an international experience specifically, that you're not going into an area that's known to have, conflict and so on. There's natural disasters to think about, and even just in terms of supervision. So having a preceptor, that we can trust and is not overwhelmed by the quantity of work that they already have to do before we have someone come along, for a month or a couple of weeks and so on. And then finally, the right frame of mind, I think, is really important. And I think you will all be aware of this, but if you're going somewhere for a couple of weeks or a month, you're not going to save everyone in that clinic, and you're not going to, whether it's a dental project or a medical project or other, you're not going to save the world that way. But you may make a bit of a difference, and you will learn a lot, as an individual. We always tell our students, go with an open mind and don't expect to change everything and save everyone. You're not going just to have some, nice pictures or just to have that part of your training in your CV. So I think it's important to know the benefits, but also be aware of these key things. And then just a couple of words for me, having had the chance to do some electives early, as I mentioned in my medical training. I did my medical school in Halifax, but I did go to Guatemala, and then we had a student group that was just starting with big interest in global health. So we coordinated a new collaboration with Cuba that was really neat. We had a few connections there. And finally in the Gambia and within Indigenous communities in Nova Scotia. So with some Mi'kmaq communities, they were very, very rich experience. And I think all of those helped develop my passion for global health. So I'm happy that I sort of started early, and I think it influenced my career choices and so on. And then after medical school as a pediatric resident here, and then I did a 2-year pediatric emergency fellowship in Ottawa, where there was some partnerships in Latin America and so on that I had the chance to participate in, and in Haiti as well. And then since finishing, then there's been many opportunities in different fields, not only in practice, but sort of education and research. And through the program that we have here, there's been lots of opportunities. So myself and my colleagues who do global health very often at conferences and so on are asked the question, how can you combine, are there ways to combine a practice in Canada with, either regular work overseas or in global health in general, in underserved communities and so on. And just heard about really neat projects and so on, in Indigenous health, and there's obviously many opportunities in international health as well, and many different ways to go about it as a healthcare provider in Canada, and ways to, I guess, to fulfill that passion if you do become, or maybe you're already passionate about global health. So next slide, please. So now I'm going to just switch focuses a little bit and tell you about our program, what we do, and what we offer students and so on in terms of experiences. Next slide. So one thing that we do every year, and I'd invite everyone to participate, is we have an annual global health fair. And this is an opportunity for researchers, clinicians, educators, and so on to really share medical knowledge. We have talks being given. We have different themes in the day. We have poster presentations. So it's really neat. It's a really nice way to collaborate and network amongst different groups here at the U of A. And it is really a collaborative effort with University of Alberta International and our office and Biomedical Global Health Research. I'll show you on the next slide an example of our fair this year. This was just before the pandemic hit on February 3rd. So we had a full day with the keynote speaker who's involved in the Aga Khan Foundation. So we had 10 different presenters with 25 poster presenters at the end. We had just over 80 participants, and the posters are neat at the end. We have both graduate and undergraduate students presenting. We have medical students telling us about their elective experiences. They'd gone to 8 different locations in the summer of 2019. And a little later, at the end of the presentation, I'll tell you a little bit more about our plans for 2021, which will be virtual global health fair for the first time. We also have bi-weekly health rounds. We take a little break in the summer, and then we start in September. So we will be starting, I believe, September 22nd or 23rd will be our first rounds for this year. And this is also a really neat way to collaborate and discuss and network. It'll be virtual this year, at least for the end of 2020. But still lots of opportunity to discuss things virtually is our hope. And it's not just a faculty and so on that are presenting, but we really encourage student presentations. We really try to make it multidisciplinary and so on. So this is something else, and I'll tell you at the end how to subscribe to the listserv if you're interested, and then you'll hear all about the upcoming rounds and so on. Next slide. And then we have our Global Health Monthly, which is a virtual newsletter that is sent to many people. And again, it tells you about the upcoming rounds that we have, some opportunities, some of the partnerships, and just some global health news that we feel are key and important for people. So I think it's a pretty good read, and it's easy to jump onto the email list if you're interested. And then Patricia will be sending you the newsletter when it comes out. And next slide. Our annual Rich Man Poor Man dinner has been going on for a number of years. This was the first year in April of this year that we had to cancel because of the pandemic, but it's a large fundraiser, and it's a partnerships between our program, the School of Public Health, the Students for International Health, and the Medical Students Association. And it's a great evening of fun and good food and presentations and so on. So I would encourage you guys. The plan for next year is to potentially host a virtual event, but we're not quite sure. This one's a little bit tougher to coordinate as a very large virtual event, but so far we've got an online auction as that portion to sort of replace the fundraising component a little bit. So we will be able to update you on this a little bit more. Next slide. And specifically with regards to electives, this is applied more to med students in the past, but we have what's called a 12-hour global health elective, and it's a part of the pre-departure preparation that we do for students going on international projects and so on, and there's various components to it. And those who will be participating in electives will be speaking to you again about this and your global health reps and so on. But I thought I'd just mention a word and help coordinate this. Next slide. So on the topic of global health electives, this is an important part of our program. And just to give you a few numbers, so last year in 2019, this is pre-COVID, give you an idea, we had about 66 different students and one resident participate at various field stations, which I'll tell you about next. We have some European partner sites as well through the Faculty of Medicine and the IFMSA, the International Federation of Medical Students, so they have sites as well. 2020, unfortunately, all electives had to be canceled, sort of late in the spring, early summer, and it is unfortunate because we had one of our largest number of students planning projects, and we had put a lot of work in this, and my colleague in the office, Patricia, had put numerous hours in planning. But anyways, the pandemic came, and we were also targeting 9 different of our field stations and partnership sites. So, and the next slide. In terms of electives, there are many different options. I've mentioned the field stations that I'll tell you about in the next one. There are some European partnerships for the medical students or the IFMSA. There's also, many different charities, and I'll mention for the dental students, dental hygiene students, there are partnerships with charities that have been long-standing, that are very strong. And then some students will organize their own projects as well, which is fine. So there are many different options. Next one. So a little bit about our field stations in the last few minutes here. So this is a program that's been going on for a little while, and we've built up these collaborations with sites around the world. And we'll just go to the next slide and I'll show you an idea. So in terms of the guiding principles, we try to have these partnerships with sort of a clear framework, agreement with the other site and so on in terms of where the needs are and the capacity. It's mainly for students, but of course there's strong faculty involvement, especially when it comes to like the research parts and the educational and teaching on site and so on. We also try to prepare the students with things like the 12-hour global health elective that I've mentioned and pre-departure and so on, and also try to help in terms of the funding and the faculty development with these sites as well in the next few years, and try to coordinate so that we have strong preceptors and that, we sort of know our partners there, where the students are going to as well. And the next slide. So we have sort of a list of some major collaborations and like strong field partners that we've had for quite a few years. We've had lots of students, medical students and pharmacy students, mainly with Fudan. In Uganda, I won't go in detail, but we have 3 different sites within Uganda where we've had some really neat partnerships, and one of those is at the Jinja Hospital, where Dr. Michael Hawks, from a colleague of Dr. Lewis's and I in pediatrics, he's a pediatric infectious disease doc, and he's brought students to do a malaria elective, and it's been very, very popular with students. We've had a strong partnership with Nepal now for a number of years, along with Taiwan, specifically in emergency medicine. And the next slide. And this is just a list of some that we're in the process of developing and have been in contact with in the Philippines. I've taught there in the past, and we're building a partnership with the Philippine General Hospital there. We've had projects in Ethiopia, a large research project, and we've had some students and residents go in Ghana as well. There's been a pediatric partnership for a number of years. And in Kumasi in Ghana is a new one that we're discussing. This is just pre-COVID, but hopefully we can move forward. Next paragraph. So in terms of prerequisites, I won't go through details, but there's a number of things. We try to have it as structured, as possible, make sure that the students are ready before they go in terms of understanding risks and being prepared, having a set of objectives and so on. And I just want to mention, so traditionally, we've had mainly medical students participate in these, but I think in future years, there's really no reason why students from from other programs, such as the rest of you guys, there's no reason you could not participate, or really, as long as we, maybe tailor things a little bit to your needs and to your program. I think there's a lot of opportunities, and I'd be happy to discuss that as we move forward here. Next slide. So on the dentistry front, there's been, as I mentioned, some long-standing partnerships. The students host a fundraising gala every year to support the initiatives. And traditionally, the students have gone for 1 to 2 week dental missions. There's been strong partnership in Central and South America, but people have gone to other countries as well. There's links with 2 groups, Kindness in Action and Dentistry for All. And I'll give you the name of the contact person, Suzanne, at the end, that said she'd be more than happy to answer questions about all these. So just like our electives have been put on hold for 2020 and potentially for 2021, no one knows for sure. I know the dental projects, they have officially been on hold, put on hold until 2022, until things are hopefully a little bit better in the world with regards to the pandemic. Next slide. So quickly, our plans for the upcoming year. I'll show you on the next slide here. As I've mentioned, we've had to sort of restructure our projects, especially everything involving some international travel and so on. Our rounds as well. We're doing virtual rounds. We're doing a virtual global health fair. We're looking at opportunities as well within Canada to maybe have students work with vulnerable populations, refugee populations in Edmonton and so on. So there's a lot of things that are in the works. I encourage you to get involved. And if you're interested, you'll see at the bottom there the website for our global health program, which is within the Division of Community Engagement, which has been mentioned. You can join our Global Health Listserv, receive the newsletter, participate in our noon rounds that are starting in September, and then hopefully have many of you participate in the Global Health Fair, which is in February of 2021. And on the last slide, following up here, I've got our email address for the Global Health Program, myself and Patricia, and then Susie from Dentistry said she'd be happy to answer questions and be in contact with students as well. And I think we've got maybe 3 minutes for questions. Thank you very much, everyone.